Good morning, everyone. Um, so, welcome to the Occupational, Environmental, and Climate Medicine Grand Rounds at UCSF. My name is Ramat Balogan, and I'm the program director for the Grand Rounds program. We meet on the second Thursday of each month from 8 to 9 a.m., and the complete Grand Round schedule is on our division website. I'll place that in the chat. Additionally, this year we have Notes from the Field, which is directed by Dr. Bob Harrison on the fourth Thursday, and it's an informal discussion from 8 to 9 with leading experts in the field. And then this year we have a new CME office and a new process for claiming credit that's available only if you join the live session. If you haven't already signed up, I'll put some information for that in the chat as well. And then we ask that you please keep yourself muted during the presentation. Feel free to add questions in the chat, and we'll have about 10 minutes at the end of the presentation for questions. Today is a special lecture, the 6th annual Herb Needleman lecture, and I'm going to pass it on to our division chief, Dr. Gina Solomon, to introduce our speaker today.
Yes, thanks, Hermod. And every year we have a Grand Rounds that is put on by the Western States Pediatric Environmental Health Specialty Unit. And I will put the link to the PACU in the chat so people can check it out if they're not familiar with what we do. And the PACU is part of our division of Occupational, Environmental, and Climate Medicine at UCSF. We serve Nevada, Arizona, California, Hawaii, and the Pacific Islands. And and I see several important other folks on this call. The former director of the PACU, Stephanie Holm, shout out. Great to see you on. James Nolan, who is the associate director, and Tamer Durrani, who's the director of the PACU, and I'm the principal investigator. And Mark Miller was on here somewhere, the founding co-director, and still with an important role in the PACU. So I wanted to talk for just a moment about Dr. Herb Needleman, because this lecture is named after him and is given in honor of him. He was really a transformative figure in pediatric environmental health. He was the first person to make the connection between low-level lead exposure early in life and lingering neurodevelopmental effects in children. And he did absolutely brilliant research using samples such as baby teeth to identify lead exposures, following those kids up over time. And for that amazing science, he was attacked relentlessly by the lead industry and by many forces in corporate America who did not want to see lead restricted in any way, or let alone banned for uses such as in paint and gasoline. And so Dr. Needleman really was a hero in public health, not only because of his contributions to science, but because of his willingness to speak out on the policy implications of the science, and the fact that he really stood up to really a lot that was thrown at him. He was accused of scientific misconduct, which was completely false. A lot of history there to read up on for folks who are interested. And so it seemed super appropriate to have as this year's Herb Needleman Memorial speaker, Dr. Tracey Woodruff, who up until extremely recently was one of us at UCSF. Unfortunately, recently left us for Stanford, with a joint role at School of Medicine and the Door School, but I'm sure we'll be working together closely going forward. And Tracey is not only a leading expert in environmental health, not only was she at EPA for many years as a senior scientist and policy advisor, And not only was she the founder and director of the UCSF Program on Reproductive Health and Environment and EaRTH Center, but she also has been a leading voice on not only, paving the way on the science, but also making that link to policy and not being afraid of the fact that there are often major forces aligned on the side of sort of protecting the chemical industry and some of the chemicals that are of concern for children's health in our environment. So that I think, so basically today, Dr. Woodruff will talk about challenges and strategies for protecting kids from environmental hazards. And so please join me in welcoming Tracey Woodruff.
Thank you, Gina. And it's really, thank you for having me today. It's really a pleasure to follow in the footsteps of Herb Needleman. And you already, I want to say I have no financial conflicts to declare. And let me just this up here. And you covered Herb Needleman, but I want to go back a little farther in time to set this talk up to talk about Alice Hamilton, who also worked in lead and was a pioneer in industrial health and safety, and something kind of the founder of the other component of your program, which is occupational health. She was the first woman professor at Harvard. But interestingly, in the 1920s, she shifted her focus from a lot of work she'd been doing in the industrial setting to focusing on tetraethyl lead, because she was at Harvard during the time that the Ethyl Corporation was focused on introducing lead into gasoline as a, quote, anti-knock. She was really one of the most prominent scientists arguing that leaded gasoline was a public health hazard rather than an industrial one. And she also, interestingly, predicted that lead from cars would accumulate in street dust and be inhaled by children, which, of course, have seen over decades. She was also challenged by the oil and auto giants, and this culminated in a 1925 Surgeon General's hearing. So the Surgeon General organized a conference on tetraethyl lead, and it was designed to basically feature the public health community, but also the gasoline industry, to talk about whether leaded gasoline was a public health question or merely an industrial safety issue. And this really pitted the public health industry against a public health community against industry. And I just want to recommend these two excellent papers at the bottom, which covers some of the histories, because I think this is super relevant to today, in that we saw the emergence, because in the 1920s, we're seeing the growth of the industrial complex in the United States. And we also see kind of the emergence of this public health versus industry argument that comes from the conference on tetraethyl lead sponsored by the Surgeon General in 1925. And I just want to note some of the things that you probably are going to think, wow, that sounds super familiar today. Alice Hamilton was focused on a more precautionary principle, basically don't use the lead until it's proven safe. The industry's response was this man, Robert Cahoe, who was a very prominent MD in occupational health. He had been trained in Cincinnati, and he was working on behalf of the lead industry, including Ethyl Corporation. And he was putting out his version of the industry position, which is don't proceed until proven harmful. There was also you can see the two positions between the sources, accumulation and dust. And Alice Hamilton said that we will, at the bottom, I put this quote, we shall find that we have been very too much optimistic about this thing. Lead is a slow secret poison, which certainly was proven to be true. And that the industry's position was that lead is naturally occurring, technically, and low levels are harmless. And he also, I put in note, and then the responsibility, this was also see this too today, that the public health version is that manufacturers are responsible for public health safety, and the industry was promoting that the individual worker is responsible for hygiene. We see this today again, and a lot of the focus on workers. They should, they're the ones responsible for using PPE, and that they're the people that need to be stopping the exposures, not the industry. He also, I thought this was very interesting, introduced the concept of a threshold and that there was levels of exposure that could be identified that would not result in harm. And I think we see this thread also happening throughout the history of toxic chemicals. There was an alternative at the time, which was ethanol or other organic additives, but the industry said there's no other options exist. Lead is a gift from God. And as we all know, lead was the end result was that despite the public health argument, lead was added to gasoline and resulted in widespread exposures to the public. Herb Needleman was a very important figure in identifying how these low levels of lead, which some of it came from gasoline, paint, and many other sources that was added to, resulted in not only child health harms, but adult harm that he didn't work on, but also resulted in adult harms as well. So fast forward, as Gina mentioned, I worked at the U.S. Environmental Protection Agency, and I think this gave me a really important insights into how decision making is made in the United States related to environmental chemicals at EPA. And I had the opportunity to work on developing the first national mapping of hazardous air pollutants. I and others at EPA led the America's Children the Environment Report. And I also worked on how EPA assesses hazards and risks from chemicals, including I worked on the cancer guidelines and then the supplemental guidance for identifying susceptibility from early life exposure to carcinogens. Essentially, EPA from this report added a factor for carcinogens for exposures during childhood that are mutagenic. But what I found was that, and I had the opportunity to participate in a lot of different aspects of either rulemakings or evaluating scientific assessments for all these different chemicals like PM 2.5, perchlorate, methylmercury, zinc, methylethyl ketone, perchloroethylene, trichloroethylene, phthalates, BPA, not so much PFAS, PBDs, a little bit of glyphosate. But what was interesting was that when I was at EPA, every single one of these pollutants had their own own industry opponent to whatever EPA was doing. And then we used to say when I was at EPA that it seemed like every single chemical had its own set of lobbyists. And here's some of the more famous ones on here, including the American Chemistry Institute, which actually represents many different manufacturers of toxic chemicals in the United States. And one of the challenges that we would have at EPA when we were doing IRIS assessments, which IRIS is the Integrated Risk Information System, it was considered it was in the Office of Research and Development, which is the home of the science component of EPA, and was considered the definitive source of the hazard and risk assessments that EPA used, and states and other people use internationally for the basis of decision making. As under this administration, ORD has been disbanded and the IRIS program has been removed because it successfully did identify toxic chemical exposures and risks. But at the time, the arguments were very familiar, as we still hear today. And some of the things would be because we relied a lot on animal data, and the industry would say animal data do not predict human data do not predict animal data, modeled exposure data is too uncertain, measured exposure data does not agree with modeled data. So you can see these are the argument is made depending on the point which data is available by the industry. But my favorite was when a very high level scientist at EPA, when we were EPA had been working on a petition to delist methylethyl ketone as a hazardous air pollutant under the Clean Air Act. One of the head scientists at EPA said this: "My gestalt of the data is that it is not toxic." And it was because EPA was receiving a lot of pressure from the industry, or in some cases worked with the industry on these toxic chemicals, and they often would resort to these statements that really didn't have a lot of scientific basis and to respond to them. And I think this is covered really well. I just want to props to Gina, who was an author on this paper, which shows, I think, for early on in the 2000s that from industry documents, tobacco industry documents archived in the UCSF Tobacco Industry Documents Library, that the industry works very closely with lobbyists to essentially promote their version of how the science should be used at U.S. Environmental Protection Agency. In this case, the tobacco industry was focused on pesticide regulations because of pesticides that are used to, in crop commodities. And in one particular case, they hired uh, a woman who used to be very high up in the Office of Research and Development to help them argue with EPA about basically changing one factor in the risk assessment, which would change the regulation for this pesticide from toxic to safe. And they were actually successful in this activity. So fast forward again, I come to UCSF, and as Gina said, I was the first director of the program Reproductive Health and the Environment that was founded by Linda Judice, who was the head of OBGYN at the time. And really our program focused on research that was targeted toward making sure that we were answering questions that could be the most helpful in informing interventions, whether it was at the individual level, working with the clinical community, or a big part of our focus is on the public policy interventions. So as part of the science development, we also are very focused on how do we take the research that we have and transform it to improve clinical care and public policy with a goal towards improving health. And I joined EPA in the mid 1990s, UCSF in the 2000s. And during even that time in our career, and there's some people I think on the call who can also speak to this, that there has been a great shift in the nature of disease in the population. So in the 1990s, communicable diseases had the highest share, close to the highest share of the proportion of the global burden of disease, which was 46%. So communicable diseases include like malaria, tuberculosis, but that has shifted between 1990 and 2019 so that now communicable diseases, as you can see, here's the chart right here, non-communicable diseases are now the highest proportion of the global burden of disease at 64%. And this includes conditions like cancer, respiratory, cardiovascular, neurological, metabolic disease. So what we have now is non-communicable diseases are both the driver of adverse health consequences globally, and the shift has been so rapid that it can't be due to genetics. There are external factors that are making this change happen. And the focus, and then there's been some recent data showing that pollution is the largest contributor to the global estimated deaths. This is from a series that's been published in The Lancet on what is calculating the risks from different factors that contribute to global mortality. And you can see total pollution is right here. I mean, smoking and secondhand smoke is pretty much also the same, but you can see these other factors like malnutrition, AIDS, tuberculosis, and malaria, road injuries, interpersonal violence are far behind these exogenous risk factors. And interestingly, in the Lancet Planetary Health series, and this is from the second one that was published, they note that there has been, in between the two that they published, little progress against pollution can be identified, particularly in low and middle income countries where pollution is most severe. So we're also seeing, we see health inequities and who's exposed to pollution in the United States, but it's also global as well. But I think what's also important, so there's been little progress, but also the urgent attention is needed to prevent pollution-related diseases. Air pollution, lead poisoning, again, appears as a really important risk factor in the global, and then they also talk about hazardous chemical pollution. So, and why is this so urgent is because we've seen a great growth in fossil fuel consumption, which has been the primary source of both plastic production and toxic chemical production. And what we're seeing is that there's been a doubling, for example, in plastics between 2008 and now, and there's a projected increase in plastic production going to be happening over the next about tripling by 2060, all driven by increasing consumption, fossil fuel consumption, which is also the same for projected increases in the global production of chemicals, plastics, pesticides, and then the chemicals, the feedstock chemicals that are used to produce them, like ethylene, propylene, butadiene, benzene, etc. So if this is a very concerning because these are chemicals that actually we have or in many cases, very little information about the extent to which these exposures and health hazards occur. So the estimate is there's 350,000 chemicals that are registered for use in countries around the globe, 40,000 registered for use in the United States, but we only know information about very less than 5% of in terms of their exposures and toxicity. So what we're facing now is what we're calling industrial epidemics, because this is from some work that's been done at a bath in England that shows that fossil fuels, tobacco, ultra-processed foods, and alcohol contributed to approximately 34% of the 56 million annual deaths globally. And this, as I mentioned, because we have now these industrial drivers of disease, these exogenous substances that are produced by industry and corporations that are really driving that shift in the burden of disease globally. And we see this in the United States, where there's been a dramatic increase in numerous different chronic health conditions, things like Parkinson's, cancers, diabetes. We also see this in children with the increase in neurodevelopmental disorders, metabolic disorders, and certain childhood cancers. At the same time that there's a growth in not only U.S. and global chemical production, but also other ultra-processed food. So environmental health is a really key component of the contribution to deaths, and it is a modifiable environmental risk factor, and that this was from the World Health Organization that almost 1 in 4 total global deaths are linked to environmental conditions. Okay, so what we are on since the Cahill rule, which was all the way back from Alice Hamilton's time in Cahill, who argued against her on behalf of the industries, and then we're on this kind of endless do loop of having to like show me the data, then argue about the data, and then take an action. And so we're really focused on I've been very focused on, well, what is the missing puzzle piece in this in getting off of the cycle of constantly going through every chemical and arguing about it with the industry and then going to the next chemical. It's really an infinite do loop. So we have been working with other people at UCSF to talk about industry as the 21st century vector of disease. So in 1990, which was when communicable diseases were the majority of the global burden of diseases, you had a disease vector, which was a living organism, carries and transmits an infectious pathogen to another living organism. They tend to be they're blood sucking generally. And in 2024, we now have a new vector of diseases, which is contributing to this rising non-communicable chronic illness crisis that we have, not only in the United States, but globally. And it's the disease vector now is a corporate organism that transmits toxic environmental exposures to the public. And this is being driven by the manifestation of a global economic system that prioritizes wealth creation over health creation. And this has been identified by the World Health Organization as a commercial determinants of health. They have a project on this. They have done a report that's supposed to be released soon. And they define commercial determinants of health as a private sector activity that affects people's health directly or indirectly, positively or negatively. And so this can have impacts on environments via supply chains, marketing, labor conditions, research funding, and lobbying. And that the commercial determinants of health increase risk factors and health outcomes that include smoking, obesity, air pollution, non-communicable, and infectious diseases. So not only do we see these risk factors that are products of health harming industries, but that the WHO is also recognizing this as an important factor in determining health outcomes in the population. And they also note that young people and marginalized populations are disproportionately impacted. Now, one of the challenges if we have a risk factor, which is corporate industry practices that are producing health harming products, then we can start to think about how do we work to evaluate the mechanisms by which it acts and produces the products and influences the process to result in the fact that more people are exposed to these harmful products and then increasing adverse health effects. So we're looking at this as a way of studying a vector of disease. But unlike infectious disease, these corporate disease vectors implement sophisticated campaigns to undermine public health interventions. So it's been labeled, this is from a book talking about the corporate consumption complex, which is a network of corporations, financial institutions, banks, trade associations, advertising, lobbying, and legal firms to promote this hyper consumption of products, a pattern of consumption directly linked to premature mortality and preventable death. But we've also learned, and in large part due to the home of the tobacco and later the industry documents library at UCSF, that there is shared patterns of how corporations influence science and health and policy. So if you're not familiar with this research, there's a pretty reasonably large body of research on corporate influence on science and the policy process, which has informed the development of multiple typologies and frameworks to characterize these different tactics and strategies of influence that lead to increasing non-communicable diseases. So these frameworks generally cover 3 different mechanisms of power: knowledge capture, policy capture, and shaping public discourse. And so knowledge capture is essentially influence over knowledge and perceptions of corporate products and how they affect health. Policy capture is influence over decision-making, regulations and agenda setting, and shaping public discourse, influence over public preferences for products, perceptions of harm, and the role of responsibility. This is a reference down here. And essentially, these all focus on increasing the manufacture and sale of health-harming products and leading to increases in non-communicable diseases and death. So as I said, a lot of the research about what we know about corporate practices comes from what the corporations say themselves from the UCSF Industry Documents Library, which is an amazing resource of publications of 21 million documents, started with the Tobacco Documents Archive, but has been growing to add chemical, drug, food, fossil fuel, opioids. So it provides a mechanism for doing empirical-based research on the ways that the corporate complex influences the science, regulatory, and health process leading to increasing disease. And just for example, the tobacco documents themselves have led to over 1,000 peer-reviewed publications, have shaped U.S. regulation, and led to the Global Treaty on Tobacco. But they have a playbook. So what is the playbook that we will be using? So the goal of understanding a vector of disease is to how does it act, and then what are the areas that we can intervene to prevent those, to turn back or prevent those types of actions in order to lead to improved health. So that's been a big focus of the work that I have been doing at UCSF, which focuses on looking at some of these different mechanisms that are used to influence the decision-making, the science or decision-making process, and then providing an alternative. So let's look at setting scientific standards, which was something I'm super familiar with from my time at EPA. And we can look at their playbook, so in terms of how the industry acts, their tactic is to develop and implement scientific methods that essentially underestimate hazard and exposure. So a counter tactic, and something that we've developed over time, is develop and implement scientific methods consistent with best available science to fully identify health harms and risks, and to also identify how these other methods can be flawed in terms of their scientific methods. So for example, one area that we have advanced at UCSF and has now we've seen a lot of uptake across the global government and even across the federal government and even globally is systematic review methods. So under, and I'll just talk a little bit, systematic review, which comes from we use based on what's been used in the medical field, such as the Cochrane collaboration, is an approach to provide a transparent, consistent, less biased evaluation of the scientific method. Now, EPA, in their use, I have in some of the offices. This is under the method they've developed for the Toxic Substances Control Act, which is the primary act that covers chemicals in the United States, have a systematic review method. But in general, EPA's approach to evaluating evidence is essentially cherry picking. And I know because I've been involved with many IRIS assessments, which is, they would like look at some of the literature, they wouldn't have all the literature, they'd evaluate some science one way and some science another way. And it was all kind of undermined or kind of focused on answering the question that they already providing an answer to a question that they already was kind of pre-decided. So what we've done is develop what's called the navigation systematic review method, which breaks this cycle and provides a structured approach that ensures that all the science is considered. It's considered in the same way and consistently, and provides a bottom line summary of what the science says so that actions can proceed from there. Which also, okay, this is just an aside, but I have to tell the story. So when I first got to EPA, EPA does identify the strength of evidence on cancer. So chemicals can be a likely carcinogen, a known, likely, probable, suggestive. And for all the other health effects, they just have this number, which is supposed to be, quote, a safe number. And above it is no problem. Exposures above it is a problem. Exposures below it is not a problem. And when I first got there, I was like, oh my, this would be so great if we could identify which of these toxic chemicals are related to, for example, our neurodevelopmental toxicants or, other types of things. And I was just like listserv, and one of these scientists on listserv said, EPA will never say whether a chemical is develop a list of neurodevelopmental toxicants, and we've stopped it from happening this time, and we'll continue to stop it from ever happening. So that's the kind of level of which these government agencies can be very captured by not fully identifying all the health risks from these toxic chemicals that can be used by people outside the agency in decision making. So the navigation guide is primarily developed to uplift what are all these other health effects that these chemicals can be causing that we don't know about, because essentially EPA doesn't have a bottom line summary about the hazards of toxic chemicals. Okay, so the method has been developed and tested. It's endorsed by the National Academy of Sciences, is used by WHO and ILO. We've also seen other agencies take up these methods, including the IRIS, the Integrated Risk Information System at EPA, and the National Toxicology Program at NIEHS. And you can see that we've, over time, slowly worked on in integrating what's best practices in how evidence should be evaluated. So we've looked at PFOA and birth weight, prenatal exposures to PBDs and neurodevelopment, air pollution and autism, triclosan, PFOA and immune. Oh, that's actually National Toxicology Program. And then we participated in the World Health Organization and International Labor Organization evaluation of occupational risk factors. And I mean, the thing that's amazing about these methods, which again come from Cochrane, is they illuminate something that was there from the studies, but you didn't know. So for example, the World Health Organization, ILL, for the first time identified that long work hours were a risk factor for cardiovascular health effects. And the extent to which this was a risk factor occupationally, it went from nobody knew it was a risk factor to it was one of the leading risk factors for occupational deaths worldwide. So being able to put identify a hazard and put some numbers on it has a huge effect in the ability to at least illustrate a problem and leads to action. We also did an analysis of how EPA's methods at least in the Toxic Substances Control Act were being applied were not consistent with best practices of systematic review. So because we'd been developed this method that was consistent with best practice that had been developed over many years from the Cochrane collaboration, which had an empirically based basis for the method, we could also look and see, we could both use the right method, but also identify where the method was being used inappropriately. The second component of identifying best available science and promoting it is work that we've been doing through a science action network we started almost let's say 8 years ago, which identifies key principles that should be integrated into public policy to protect people from toxic chemicals. And the number one and we did this in collaboration with scientists, community and government collaborators to develop these recommendations because it's important to have many people talking about this. And the number one is to safeguard science integrity because this is a foundational issue in terms of without science integrity and removing corporate interference in decision making, we know from a long history in this field is that creates bias in the scientific and decision-making process. So it's a underlying principle is to science integrity and remove corporate interference, and then use best available science and focus on protecting health for all. And we also developed some other methods about more detailed recommendations about how in the current process of how EPA does their decision making, it can be improved to represent best available science, including better assessing population variability. Really, we have quantifying non-cancer health outcomes, but essentially making visible all these health outcomes that currently are invisible in the decision-making process, both either federally at the state level. So all these non-cancer communicable diseases that are going up, metabolic disorders, low birth weight, neurodevelopmental outcomes, they're essentially invisible in the decision-making process at EPA, mostly. Improving exposure assessment and regulating by class. Okay, so what was the outcome? Well, the outcomes were we established an empirical evidence on chemical industry strategies to develop and implement science methods that this is the outcomes the chemical industry is using. We were able to identify support calls for EPA to use scientific methods consistent with the best available science and fully quantify chemical risk. And we've seen a lot of authoritative bodies, particularly the National Academy of Sciences, both talking about how EPA should change their approaches and recognizing the importance of these new systematic review, not new so much, approaches, and that directly speaking to the importance of having that for government decision making. So there's 5 of these NAS reports, and I think there's even more. And essentially, it's been embedded in the National Academy of Sciences that EPA decision-making should use these systematic reviews, and they should use the best approaches, and also not the approaches that are currently being used under the Toxic Substances Control Act. And then also importantly, excuse me, Congress has also asked, obviously this changes depending on who's in charge, but this is from at the time in 2021, Chairwoman Johnson asked EPA to review their methodology that they're using to evaluate chemicals under the Toxic Substances Control Act. So that's on standard settings. So you can see we've developed a path forward for an alternative approach to how science should be used in standard setting to fully evaluate the information and produce a more a less biased outcome. But also the other strategy that we've been focusing on is the industry produces industry-funded science to skew the evidence base. And the counter tactic is non-industry funded science, which is science that's funded by the government. And then also there's an empirical basis of research looking at quantifying the association of industry-funded science with the outcomes. I focus on chemical studies, but I'm going to talk about that a little bit. So as I said, we developed the systematic review, and then we've been using it in multiple different case studies, including PFOA, and I'll talk a little bit about perfluorinated chemicals, which are PFAS chemicals. As I said, triclosan, air pollution and autism, PBDEs and IQ, and all of these formaldehyde and asthma, and they've gone on to be very influential in different aspects. So, for example, in this systematic review on PBDE exposures in IQ and ADHD, we concluded that there was sufficient evidence that increasing PBDE exposures is related to decrements in IQ, and we could actually calculate the relationship between PBDE exposures and decrements in IQ, which are actually on a very similar scale to lead, which we found. So people think that another industry tactic is to say, well, we already know what all the toxic chemicals are. We just have to focus on those. But it's actually, we don't really know. And sometimes we find other chemicals actually have as much or could even be greater effects. And this went on to be really an important component, not the only component, but an important component of efforts in the state of California to ban PBDs from furniture. There's also, as I said, there's been papers looking at quantifying the association of industry sponsorship. This is an area we haven't been doing quite as much in, but there has been a large empirical database of research looking at how who funds the study, how that influences the outcome. A lot of this is focused on tobacco. So when you look at environmental studies on environmental tobacco smoke, the most important factor in identifying whether passive smoking is harmful is who funded the study. And if a tobacco industry funded the study, it's 88 more times, well, it's roughly, to not find harmful effects of environmental tobacco smoke. And why great, that is the most important factor in determining whether a study finds harmful effects. So that is pretty well established. We've also seen this with pharmaceuticals. This is from a Cochrane review, looking at published drug company studies and drug studies, finding that published drug company studies are more likely to have findings that favor the sponsor's product, basically favor the pharmaceutical, even when the methods of the study are as rigorous as the non-industry sponsored studies. So I think the important part of this is that there's a large empirical basis of literature showing that even when you control for the other factors on study quality, there's still a bias being introduced by who funds the study. And this has been really important because one of the factors that has been very important in moving this into the environmental field is that there's been we've been focusing on how do you minimize the influence of funding bias. Well, you need to account for funding in the evaluation of the potential methodological biases in the study. And indeed, so that's one. So there's two factors. There's published studies and then account for industry influence. And I just want to say why these PFAS, these systematic reviews are so important. This is from the drinking water standard that EPA promulgated in the Biden administration. Every EPA decision has to have a benefit cost analysis, even if it's not required in the law. And this proposed drinking water standard, which would essentially lower PFOA and PFAS into almost very close to zero, resulted in $1 billion in health benefits. But because we had done that systematic review very early on increasing PFOA is known to lead to decrements in birth weight, which was affirmed by the National Academy of Sciences, it was included in this benefit cost analysis. So here's where before EPA essentially doesn't account for things like adverse birth outcomes. They've done a lot on cardiovascular benefits, and that is actually came from work in lead on the benefit costs of removing lead from gasoline. And they do cancer because that provides a dose response mechanism. But really doing birth weight is in moving into these areas where you have other types of health consequences had essentially, as I said, been invisible. And here now you have annualized birth weight benefits almost equal to the cardiovascular and the cancer benefits. And that's because, in part, because if you improve the birth weight of babies, you have less birth weight babies, EPA actually calculated how many infant mortality deaths would be avoided, which was about 1,000. And it turns out that's I think almost 10% of births in the particular year they used. So you can see how making visible this information can have a profound effect on the ability to regulate chemicals in the federal government. And then in terms of the risk of bias, so numerous reports by National Academy of Sciences on that have done evaluations of systematic reviews done by the federal government or on the methods that the federal government's using for systematic reviews have consistently called for the federal government to consider funding source as a risk of bias. Basically, the agencies in their risk assessment should account for the fact that there's financial conflicts of interest in studies and that can adversely bias the outcome of those studies when they're evaluating the overall quality of the evidence. So you can see that we're starting to, not has EPA or any of these federal agencies done this? Not yet, but it lays the groundwork for later implementation. And then the other factor that is suppress unfavorable science, and what the counter tactic, and we base this on a lot of work that's been previously done by researchers at UCSF, to use internal industry documents to sunshine chemical industry strategies that suppress unfavorable science. And I'm just going to briefly talk about the work that we've done using the documents in the documents library. It was led by Nadia Gaber, who was a postdoc at the time.
No, I just put it on here.
Oh, sorry. How PFAS was science, which perfluorinated chemicals were a really big product and from the 1940s on, and toxicity was not really established until 50 years later, and why these were manufactured by 3M DuPont. And we essentially looked at the documents that were made available, internal industry documents made available through Rob Bilot's legal suit against DuPont and 3M, to evaluate a timeline of what the industry knew versus public knowledge and analyze their strategies. And essentially, PFAS production starts here in the 1940s, but it really isn't until 2011. You could say this is very similar to lead, that there was more definitive links to PFAS and diseases. And now PFAS is like a very highly studied chemical. But you can see that from here, the timeline of this is all the orange is what the industry knew about systemic toxicity, liver toxicity, reproductive outcomes, other cancers, testicular adenomas, all in the 1960s. And then this is when we, the public, started to learn about the toxicities. And you could see that there was a pretty large lag. For example, DuPont knew in 1961 that Teflon increases liver sizes at rats at lower doses, which is definitely can lead to metabolic disorders, but also can increase the risk of cancer. And they also, and these are documents saying in their own words that PFOA had the ability to increase the size of the livers. The chemical should be handled with extreme care. And after that, it was added to every pot and pan in the United States, not everyone, but it was highly toxic when inhaled and moderately toxic when ingested. So the chemical industry knew for a long time that PFAS was toxic, but yet they hid these health harms. And then we were able to use these as, again, industry strategies on how the science is suppressed or manipulated based on topologies developed by people who've done work in the tobacco industry. And we can identify the different types of strategies they do, whether it's influence or research agenda, fund favorable research, and mostly what we found was they were suppressing unfavorable research in the public discourse. And what ends up happening is these findings can be used to support calls to hold corporations accountable to academic standards of data sharing and open science, something that we've been working on more recently. And finally, corporations influence science and health policy by shaping public discourse, whether they've messaging campaigns, PR companies, capture of civil society through front groups, think tanks, and consumer groups. So the counter tactic we've done is to basically be more communication around the health harms and tactics of the chemical industry. And so this means a lot of communicating with the public, primarily through journalists, and talking with them both about what the science says about these toxic chemicals and effects on chronic health conditions, which many, like I've talked a lot to New York Times reporters recently over the last year, and a lot of them still do not think that these chemical exposures or exposures to plastics or things that we know are well established, particularly affecting children's health, are a very large risk factor for this growing burden of chronic disease. So I think this is a continued educational, informational sharing to let people know about what the science is, and in part because they've been hearing from the other side about how the science shows that these health harms don't really matter. But we've also done work to go to Congress to talk to them and discuss the issues about what is going on in terms of what we know about the science, what's best available science, and what has the industry been doing to hide or obfuscate the science. So um, um, I really focused on this is work as we've been doing on looking at chemical exposures, effects on adverse health consequences, but there's many other, this is not the only product, harmful product that's being produced, and also these so which includes ultra-processed food, alcohol, um, chemicals, tobacco. And as you note that from the work that Gina was involved with, these chemical companies or these companies also collaborate together to advance shared strategies, whether it's pesticide working with tobacco or tobacco working on air pollution. They're collaborating. So what we have done is to really expand our ability to work together, to collaborate across different sectors, which has been launched through the Center to End Corporate Harm, which is work with faculty across the UCSF campus and at some and other campuses to advance a just, healthy, and democratic society where public health policies are built on unbiased science free of industry influence. And we have a set of strategies that we've been focused on, which is to conduct research. Again, so it follows the same kind of focus that you might have for a disease, focusing on how to prevent a disease. We conduct research, focus on revealing industry tactics. We sunshine the factors of the relationship between how the industry manipulates the scientific and the policy process, and then we communicate the findings to rebalance the scales and protect health and democracy. And so, as I said, this includes many people across the UCSF campus and outside the campus, with partners across the UCSF campus and other universities, Colorado, Nevada, Sydney, and Erasmus University. Pam Ling is the head of the Tobacco Center, and Laura Schmidt's an expert in ultra-processed food, and Chris is head of the library, and Nick is a collaborator who's at University of Sydney. And the Center to End Corporate Harm has 27 members from varying, it's probably estimates, so people can join. And we will be expanding it into a multi-institutional center with Stanford University and other partners to follow. And I just want to end by talking about, it does feel, I mean, advocates is working this and people are like, oh, this is overwhelming. There's so many chemicals and they're going to grow more plastic, and they're not going to grow it. They're going to make more plastic. But I like this this report, this graph from I found it in a book that was published about the first Surgeon General's report on smoking, but I think it's been recreated from other documents. And when tobacco was embedded in the U.S. economy, it was the sixth largest crop. The average adult was consuming 12 cigarettes a day, and tobacco taxes provided billions in revenue to state and federal government. So you had this super embedded harmful product in the U.S. economy. And you can see the per capita smoking increased greatly until essentially the Surgeon General's report on smoking and health came out. And then this helped. So there was science. There was also collaboration with other groups. So the non-smokers movement, the non-smoker rights movements begin. There's policy interventions, broadcast ad bans, taxes, further science, a lot of engagement by academic and civil society groups. And as you can see, smoking has decreased dramatically in the United States. That doesn't mean there aren't other products that they're producing like Zyn, but it's a good thing, provides a hopeful role model for how we can, once we elevate the issues and develop a strategy to counteract it, we can see a great decline in a harmful product. And with that, I'd like to thank everyone and thank you for inviting me. It's very nice. And I'm happy to take questions.
Wow, thank you, Tracey. That was amazing.
Oh, it
And
was? Okay, good.
yeah, I love the way you wrap together so many different issues. It was interesting. A number of us were last week. We're at an event sponsored by the Center for Occupational Environmental Health at over in Berkeley on PFAS,
Oh, yeah.
and there was an explicit link actually to the history of lead. and how that relates to where we currently are with PFAS, and issues about sort of the corporate pushback on science. I also think that, although this focus today is on children's environmental health, a lot of these studies were done in workers.
Oh
So maybe
yeah.
talk a little bit about this sort of how workers often end up being sort of I guess, use a cliche, the canaries in the coal mine, and then over time, it becomes evident that population exposures in kids and during pregnancy can also be much of great concern at much lower concentrations. So maybe you could talk briefly about
Well,
that. I know we
you
don't
know
have
what?
much.
That's so interesting because really all the work in the 80s, I mean, 80s and 90s on regulation was focused on using occupational health studies. I mean, it's still used today, right? I mean, like you think of 1,3-butadiene or obviously benzene. I mean, even glyphosate a little bit is on occupational studies. But as there's been it seems like NIOSH has been defunded right over time, probably in part due to the fact that these were very successful in identifying these health risks. But we saw a shift in the federal government to focusing more on, NIH. I mean, really, children's health was that started with, right, the diets and the infants of pesticides in the diets of infants and children. That first NAS report that talked about how EPA was underestimating health risks from pesticides to children. And that led to a growing, and a lot of it came out of California. The Children's Environmental Health Network was really pushing this and then led to the Children's Health Office at EPA and, children's health really being recognized within the federal government. And I think that we've seen a shift from these occupational studies to these more epidemiology-based studies, but I think it's challenging because I mean the occupational studies are really important at first because workers are exposed in the workplace to high levels of toxic chemicals. And we know this is true because actually in the Toxic Substance Control Act in the new version, they have to account for occupational exposures, and that has been their highest risk populations that they've been focusing on in their risk management rules. And this is why the chemical industry is actually in their new proposed amendments in the House are saying they want to basically make it impossible for EPA to do any regulations on occupational health workers. So the industry is always like figuring out what the next step is. But then you shift to these children's risks, and it's true that's really an important component, but I feel like it's harder to see the risk because you need so many more people because the exposures are lower. That's good. Their exposures are lower, but I think it makes it more challenging in terms of the science basis. I don't know if I answered your question, Gina, but it is true. It's really interesting to see the shift in the what's the available science, and in part because we don't have as much science from occupational workers, even though it's not like they're not being exposed and getting sick. We just don't know what it is.
Yeah, exactly. And so, just you did exactly right. You made that link between sort of population health, children's health, and worker health, and how these all connect. And I think, oh gosh, we're out of time. I had another question, and I see questions in the chat, but I do want to respect folks' time and realize that we can't go after 9. I want to thank you so much, Tracey. It was an amazing talk. Please, everybody, check out some of these websites that are in the chat. This whole talk is recorded. It will be available on our Grand Rounds website. I put the link in the chat. Please there's also a place to, oh, here, Ramat, you should make all those announcements.
Yeah, the Grand Rounds recording will be available. And thank you so much for joining.
Well, thank you.